Good morning. Good morning, everyone. Well, I guess in California, it's good morning. Welcome, welcome. I know we got folks from all over the world here. So this is Diane Gehart. I'm here for a live Q&A about my new course, Therapy That Works Live, which launches, it's been open all week and we're closing registrations tomorrow. And so I'm just here to answer any of your questions. I'm very excited about this class. It is kind of like the culmination of my life's work, so to speak. Basically, I'm going to teach you how to do really great psychotherapy, family therapy, counseling, and I've been working, I'm a theoretician. I worked with theories my entire life. Many of you probably know me from all my YouTube therapy lectures, right? My theory lectures. And we're living in a time where doing therapy has really, really changed. And, when I trained in 1993, I started my graduate program. There were 8 theories I learned. I had to pick one theory of choice, as what we called it back in the day. And that was it. And I went and I got trained and went to all the trainings on that, and we were good to go, and fast forward 6 years, it's been more than almost 30 years. What am I talking about? Bad math. So 30 years later, I am, training graduate students to do this work, and it's a totally different landscape. They have, literally hundreds, but at least in our program, we teach them, 5 to 10 different evidence-based treatments, on top of, approximately 15 to 16, counseling theories, family therapy theories that they also need to learn. And they need to know all of this for their licensing exam. And then on top of that, we've got all the new neuroscience, and biology, and just psychological research on motivation, positive psychology, on happiness. There's just so much out there that, what I'm saying, and if you caught my webinar last week, I'm kind of moving forward, and I believe the profession needs to move forward in such a way where, just having one single theory of choice, it's just not sufficient anymore. And so when I've been looking at what I do, I really feel like there's multiple ways that theories that I use, the research that I use, the evidence-based treatments that I use, and I've kind of developed a system that actually pulls from a lot of different sources, but puts it into a very coherent, simple framework for working with all your clients. So it's not like, okay, I've got a couple, let me do EFT, a totally different model. Oh, I've got someone with OCD. What am I going to do? Oh, I have to use a totally different model. I think that's crazy. That's nuts. We need to have a system. I don't even call it a theory anymore. A framework that, draws from this incredible knowledge-based, research-based, evidence-based that we have, and systematically puts it all together. And I've just decided to call it Therapy That Works. That's my title for this approach. Because it's more than a theory. It's more like a framework. It integrates a ton of what we know in terms of research and the evidence base. And I may decide to change the name of it someday, but at the moment I call it Therapy That Works, because it's also, the fact is that you have to keep adding and shifting what you do based on what the research says and what we know. And so this course that I've developed is about teaching folks how to do great therapy that is based on our cutting edge knowledge and approaches in a simple, coherent way. So that is Therapy That Works Live. And I'm here today because the course is launching. It's closing out tomorrow. We're closing registration tomorrow. And so I was just here because I know folks have questions. There's nothing else quite like it. So I know there are lots of questions. Just in terms of the program itself, it is 12 weeks long. There are modules that have online pre-recorded lectures that you can listen to. I've been telling people, some folks are worried, I don't know if I have all time for this. I'm like, I watch all those types of videos, and I'm in a ton of online courses as well, where, when I'm doing the dishes, doing the laundry, getting dressed in the morning, that sort of thing. So those pre-recorded ones are pretty easy. And then Sunday mornings, California time, Pacific time, it is starting at 10 a.m. That is 1 p.m. Eastern time. But on Sundays, we all get together for 2 hours, and you will either be watching me do therapy, you'll be practicing the specific skills that I teach in this approach, or we will be doing using this amazing technology, cutting edge. As far as I know, it's the only CEU course that has this simulated reality where there is a client we're all going to work with. It is the best training software out there. And as far as I know, this is the only CEU course that's using it right now. So you'll get to practice with a real client while I coach you and watch your classmates do the same thing. I'm very excited to have this technology, be able to offer it in this course. So that's kind of what the course is looking like. And also throughout all of this, I do a self of the therapist piece. It's very different, very practical, down to earth. But you will be working on some kind of personal goal. I'll let you choose what type. It can be mental health. It can be relationship. It can be health, physical health. It can be financial. It can be professional. I don't really care what it is, because you're just going to learn how to set a goal and achieve it, which is going to make you a much better clinician. So, and I will tell you, the course did open last week. Already, we have a phenomenal group of human beings in that course. They are just amazing. So, I'm really, really excited about the course, who's in it, and the energy is just so positive. So you're going to have a really wonderful group of people to learn this approach with. Okay, so the purpose right now is just to have some answer any questions folks might have. So I'm going to go ahead and stop talking and see what kind of questions we've got coming in. Okay, thank you, Dana. Thank you so much for, she says your instruction is stellar. And Juan is saying I saved his rear end multiple times in his MFT program. Yeah, a lot of folks use these YouTube videos, I know, to get through licensing exams and to get through grad school. So absolutely. Okay. Hi, Diane. I am from Canada. Will the app you mention on your website work in Canada? I'm pretty sure it is the Kajabi, Kajabi is the name of the learning platform I use. And so you can go check and see if Kajabi works in Canada. I think it does. Kajabi is one of the oldest and best high-end learning platforms for like online courses. I would be surprised if it doesn't, because it's totally international. We do have an international group. We have folks around the world joining in on this class. So, but I'm pretty sure the app will work. Okay. Dana. Oh yeah, Dana went to CSUN for her undergrad. Awesome. Very cool. Yep, I'm a professor at Cal State Northridge in Los Angeles area, and I run their marriage family therapy program there. So yes, awesome. Great to have a CSUN grad with us. Okay. So are there any other questions, about the program or anything? Any other questions? Go ahead and just post them while you can. So yeah, I will just talk, a little bit about this program and hopefully answer some questions based on the other questions I've gotten from some of my other Q&As. So one of the questions I get a lot about this program is whether or not it is for folks who do you have to have a lot of experience? And, absolutely not. In fact, I think it would be so amazing to have someone just clearly and simply explain how to do therapy without, papers and textbooks, and just learn what to do. And so I think it's a real gift for those. I also have very seasoned clinicians in this program who are supervisors who've been practicing for, 10, 20 years in the program. I'm just wanting to have a simpler way to pull together all of the research and knowledge that we have in the field. Because right now it's kind of like everyone's on their own. It's really bizarre. And I guess I'm in a very lucky position as a professor, because I am forced to keep up with all the research and the theories and everything like that. And it makes more sense with my job to, pull it all together. But to ask someone who is like seeing clients 40 hours a week, right, to do and to manage all of this new information, it's just not a reasonable expectation, I think, anymore. And so we're going to have to find much more efficient ways to keep up with the research base, the knowledge base in the field. Right now there's tons of flexibility and freedom for every individual practitioner, and that'll never go away. But we also need to make it not so complex and difficult in terms of how to learn to do therapy, because there's so many people who need help in the world. And the fact that we have made it nearly impossible for new clinicians to know how to do therapy well is a huge problem. And this field has to really, start dealing with this. And the problem is we've really created a system where it is almost impossible to learn how to do, to learn how to put it all together and to change the system. Because what's happened is we all of our textbooks and resources are all based on this 30, 40, 50-year-old system where we teach everyone theories. They pick one theory, it becomes your theory of choice, right? That's what's happening at the university. Then they go to their field site, and at least in Los Angeles area, and I think most of the United States, it's all evidence-based treatment over here, So my grad school just said I could do whatever, pick my theory, and then I get to the field, and it's like you have to do this one manualized treatment for this one population that you're going to specialize in here. So there's total disconnect. Meanwhile, there's all this, neurobiology and research and positive psychology and all this other research, happening over here that doesn't even get integrated at all. Just the fact that in the standard mental health training programs, we don't actually teach how to motivate people to do things. And we don't actually teach people how to set goals and achieve them. It's we do these treatment plans with all these goals, but we don't even use the motivational research we have in the field. It's so bizarre, really, and so many disconnects all over the place. And so I just really am thinking my position is we have to change, what we do. But the problem is you got the universities doing what they do. You got the, employers and the insurance companies saying it's got to be done with the EBTs. And then you have the licensing boards who go back and make you memorize all of these individual theories in a disconnected way as how you get your license. And it's just, so the universities can't change because the licensing boards, and the employers can't change because the insurance companies. And so everyone's frozen in place in this self, referential system that we can't break out of. And it's a very large system, multiple huge systems that are extremely rigid, such as licensing boards and insurance companies are involved. And it's unfortunately, though, the clinicians who are stuck, in between all these different masters, so to speak, it's impossible to do the work well. So I'm so excited about this program because I really think it is a culmination of my life's work. It is going to teach people to do therapy in a very, very simple way. At the end of the day, there is so much agreement among all those different theories you have to study for your licensing exams, right? There's so much agreement. We just use different language for it all. And it's ridiculous that we are trying to memorize all the different language for these things when there's far more overlap than there is difference. And it's a lot of wasted energy on the part of new clinicians. So it's hard to speak and read. So right now I'm going to go and see if there are any questions coming in. So Brenda is saying, you saved many times wondering about continuing credits for Canadian counselors and psychologists. It's a good question, Brenda. So right now, you have to look at your local licensing board. I will tell you, though, I'm in the process of getting the NBCC approval, which I do believe would definitely be recognized in Canada. I can also write a statement and a letter and prove that I do everything. Actually, the California marriage family therapy one, which is my current CEU certificate, they're stricter than NBCC. So it's quite interesting. So I definitely think, though, for Canadian counselors, that would end up being covered. I'm not psychologists typically are slightly different, and so I don't know about the psychology board, but I'm very hopeful that the Canadian one, and I'm more than happy to work one-on-one with you and to get that approved locally. We do have someone in Italy who are also working to get the course approved in Italy. So I'm much more hopeful about Canada than I am Italy. So, and I do think I have the type of curriculum vitae. It's about 25 pages long. That most people see that they're like, okay, she's real. She can teach. She counts. But yeah, you would have to double check and read the fine print on whatever province you're in and how. I don't know if it's national or state by state in Canada or province by province in Canada, how the CEUs work. But I'm more than happy to help you look into that. Oh, can you say the name of the app? I can not only say the name of the app, I can put it in the chat. I hope you'll see this. Kajabi. I know. I don't know where the word comes from. Kajabi. Kajabi. And what happens is you're just going to download the app and your course will pop up in it. It was kind of funny. I was hoping I was going to download the app and I could respond to comments and post things myself as the instructor. No, the app is for students, not for the instructor. So enjoy. I was hoping to get it, but apparently it's for you, not for me. Great question. Okay, Juan, is EBT sufficient, or what would you recommend we look for in a lot of these processes? In other words, are all EBTs created equal? Hopefully it makes sense. Is evidence-based treatment sufficient? Well, the problem with the evidence-based treatments is they're all specific for a specific diagnosis. That's how they were all created. The National Institutes of Health funded research for major depressive disorder, OCD, couples, whatever it was. They didn't actually couples therapy. They didn't fund that one very much. And so it's the problem with EBTs is that they are way too client specific. Now, some clinicians, it is a small minority, may only see OCD or borderline or major depressive disorder. But that's even if that's what you're doing, there are people who have multiple diagnoses. So when it's impossible to be trained in enough EBTs to cover even the average load, even if you're in a specialty clinic, like an eating disorder clinic. You're still seeing lots of other disorders. And so EBTs will never go away because they give us such important information. But like every individual clinician, whether you're, any community mental health provider, let's say, whether you're private practice or in an agency, your caseload is still so diverse. Humans are so diverse. Humans, have experience usually not just one, isolated problem at a time. They usually have multiple issues going on. So that's the problem with EBTs. I love the research that they point out and what we learn from them. But I think the average clinician needs to have that integrated into a single framework so that they're not overwhelmed. I mean, just, every client you see, if you're trying to switch your approach, your EBT for each client you see in an average day, you're going to be really exhausted and tired, And so what I've created is to create a framework that uses all of the knowledge. The EBTs have been incredible what they've taught us to integrate that. So, you're still using the same framework even when you're working with multiple different clients. And yes, we are drawing from lots of different theories. So that's a great question. Oh, are all EBTs created equal? Well, probably not. But they're also different. They're just all for different clients. And so it's impossible for the average person to get trained in enough of them. Maybe not impossible, but it would take at least 10 years and a lot of money. So I'm hoping that this course is an alternative to that. Like, let's just take 12 weeks, and not whatever, $100,000 in trainings. And let's just make it really simple, relatively affordable course where you can how to use all of that knowledge that is out there. Megan says, can you clarify, are we practicing the different interventions in front of everyone? What will that look like? Great question. So the way the course is structured is there's a lot of learning content that is pre-recorded. You can watch anytime during the week, because I like to say I watch it when I'm doing dishes, folding laundry, and getting ready in the morning. Or so that's really easy to get that part out of the way. And then the other portion of the course is live on Sunday mornings. And so what that's going to look like, it takes a couple different formats. One format is it's a Q&A. And so I'll give a mini lecture and answer questions related to the exercises and stuff I've given you over the week or the videos. We have two of those, one related to self as a therapist, and you'll be setting your own goals and working on those. And the other is going to be on the evidence-based with treatment planning. But so then we have several weeks where what's going to happen is I will demonstrate with a live client who's going to be live with us on Zoom. I will do a therapy session with that person. We'll have, at the end of this demonstration session, I will interview the client about their experience. And then anyone in the group can ask the client questions. That's part of the setup for who I've got to come join us. They're going to answer your questions that you might have of them related to the process and how it works. And then what happens is I will give you a very structured exercise related to some of your self as a therapist issues, whether it's, we have folks trying to get, develop health, exercise habits or reduce stress or mindfulness, whatever it is, whatever your personal goal was, you'll break into small little groups of 3. One will be the clinician, one will be the client, one's kind of like the supportive observer. And we do these little mini practice exercises with each other around our personal goals, practicing the skills that you have learned that week in the course. So that's what 1 week will look like. And then the next week, we will come back for a longer session, or it can be longer. I'll be around longer if you want to. We'll have a half-hour prep beforehand, and then we will do simulated reality. And that's this new technology. Like I said, I don't think there's any other CEU group using it, where we will have this, I'm not going to tell you the whole secret to it, but it's a mixed reality, live client. And we will folks will sign up and take turns, and being the clinician, talking to the client. But we will pause a session. I will give coaching. I will help you learn how to phrase things. Like oftentimes people say something that's decent, and then I will sometimes pause and have them, refine that, ask that question in a better way. And so then there's a group listening to, and what the whole group's watching. And at any point, the group can, the clinician can pause the session and ask either me or the group for some tips or feedback, or where should I go from here? And it's the most effective training. It's a lot like live supervision if you had the opportunity to do live supervision. So it's a lot like live supervision, but it is even more effective for the actual student learning. So it's an incredible experience. And so we'll practice that way on what we call the simulation days, which are longer. And normally people are so energized, they want to debrief and ask lots of questions. So those sessions will be a half hour to prep, 2 hours with the actual live client, live simulated client. And then where we're all working with this client together. And then at the end, there is going to be a debrief for those who want to hang out and just ask more questions. So that's kind of how you'll actually be practicing those skills. Okay, Megan, let me know if that answered your question, if that makes sense in terms of what that would look like. Okay, great. Okay, good. I think they got it. Awesome. Okay, so I can see some folks are joining, and this is Diane Gehart, and so I'm just talking about my new course, Therapy That Works Live. And I'm here to just answer any questions because the course registration ends tomorrow. And but I'm just so excited about this course because it really is going to be, I think going forward, our field has to have approaches like this that really simplify learning how to do therapy. And I'm just so excited to be able to provide this. We have an incredible group that's already, it opened last week, registration opened, and folks have been in the course, and we've got an incredible discussion and dialogue going, lots of really positive energy in the group. So super excited. Dana, yes, is there a cost involved? Yes, there is a cost involved. Let's see, Carrie, if you could drop in the chat the website address for the course. Yeah, so there is a cost involved. The full cost is $2,597. You can we have several payment options. There's the one-time option paying in 4 different installments, or there's a monthly option, using PayPal credit. I have an agreement with them. So that I think drops the cost down to like $240 or so a month. So there are lots of different ways to pay. I really worked hard to try to make it affordable to everybody, because it is 44 hours of CEU credits. And so hopefully we've got folks from all different phases of life, walks of life. And I think there's a payment plan that'll work, regardless of kind of where you are with things. So very excited to be able to offer that and have some of those different opportunities to just make it happen. Excellent. Okay. I think I've answered all the questions that, that have come up. So let me just share a little bit more just around some of these ideas and where they came from, and maybe kind of walk you through some of the modules. So there's 7 modules in the program. The first one really is about the self of the therapist. And I really take a very different, pragmatic approach to a self of the therapist issues, in terms of looking very holistically, kind of really creating a lifelong plan for yourself. I give you what I use for my own personal kind of self of the therapist work. The goal, I actually have goal worksheets I use every year, and, with strategies to actually get through it. Teach a lot about mini habits, which I think are so important. And basically, you're going to practice on yourself how to shift behavior and habits. And as you learn to do that, you are going to be so much more effective as a clinician, helping other people to change, because you will have practiced on yourself. It's I think a very down-to-earth, holistic approach. And I think there's so much pressure that mental health providers put on themselves to be like perfect, to not have stress, to have perfect relationships, to have perfect kids, perfect. And so I really try to demystify all of that none of us are going to be like perfect. And to really help you develop realistic expectations, and along with self-compassion, to also develop a framework for working on yourself across the lifespan, and it is a lifelong project. And I think the more you do that, the better you become. And already I did open up week 1 already. And so folks have been really enjoying it. They've been so engaged. If any of you are in the course already, wow, what an amazing, great group of human beings. And I can just tell how they're going to be so supportive with one another, kind of working on their goals and working together and sharing tips on what works and what doesn't. And I think there's so much to learn, because each of us achieve our goals in different ways. And so part of this is, working as a group to figure it out. So beautiful, beautiful. And I think, because I am using some recordings from my last mentoring course, and there was just a lot of positive feedback in just having someone really talk honestly about these things, because I think so many mental health providers feel like they have to be perfect, and to just also be very honest. One of the things I actually go into, which it was a really hard decision for me to make, but I actually went into the concept of, what clinicians need to know around money and finances. Because let's face it, money and finances is a huge source of human stress. I do a lot of couples therapy work. And often money is something that couples are arguing about. And one of the things I've found, and even doing supervising with my students, if you don't understand like how budgets work, how money works, how to live within a balanced budget, you can really create some insanity for a couple if one person has very unrealistic expectations about how to spend more money versus another. You can sometimes with couples, they're both very realistic. They just want very different things and have different philosophies. That is one. There's one way you intervene with that couple, but sometimes you end up with a couple where one person just feels, wants to spend way beyond what is just financially possible for that particular couple at that moment in time. And you have to intervene very differently with that type of couple. And if you don't understand money in general as a clinician, that you're going to have a hard time navigating that. So honest to God, we even go over financial wellness and understanding that and working on that yourself. Obviously, none of us are going to ever be CPAs or any of that, but we need to have a certain amount of knowledge, not practical life knowledge around these issues. So I go into areas and I don't think anyone else has ever gone into. So that's module 1. Boy, a bunch of questions are coming in here. So let me see what we got here. Oh, Megan Logan, tell me about the 25-minute consult. Oh, you get me for 25 minutes for whatever you want to talk about. I will help you with anything you want to talk about. I'm assuming most people are going to want to talk about some of their personal or professional goals, but you got me for 25 minutes. You can use me any way you want to. It's professional consultation. So wide open. Let's see, another question. Someone came in listening. Oh, so the question's coming in about how would this complement my family therapy training and qualification? I would have to say that I think it's just going to make your life as a family therapist so much easier, because you're going to have a single framework that pulls all the theories together, the evidence-based treatments together, and the psychological research, neurobiological research together into a single framework, so that when you go into session, whether you're working with an individual or a couple or family, I have one way that you're going to assess. It's got 4 levels. But it's beautiful. Pulls it all together with a bow, so that it becomes so much cleaner and simpler what you have to do to conceptualize your case, how to connect with your case, and how to use all the evidence and research we have in a way that's easy for you to deliver it. So I just think it's going to make your life and your professional life so much less stressful than trying to think, okay, so I've got an individual with anxiety. I'll use this model. Oh, next session's couples. I'll use this model. Oh, next session's family. I'll use this model. I mean, what would it be like to just have one way you work with everyone and you can just consistently use that? That's just highly effective. I think what you're going to love about this approach is that it really has, I believe I have boiled down, after writing so many books on theories, I think I've boiled down and really can show you how they all fit together, so you can use multiple theories at the same time. In module 3, we'll get into this incredible assessment intervention that it pulls from a lot of different theories in a very, very simple, coherent way, including looking at social location and social justice issues. It's really going to be a simple, elegant way to work. Great. Okay. See. Okay. I think Megan, if I didn't answer your question, I see it twice, so you can go ahead and answer. If you want more information, Megan, go ahead and ask that. Let's see. Juan is asking. So Juan is asking, what are your thoughts on choosing 1 or 2 theories, learning it well, and having it as your point of departure for other theories? Absolutely. I think learning any theory well, I think everyone should learn to master one theory really well. And so, this therapy that works is the theory that I've developed, and I think answers a lot of questions. But, it just depends also what those theories are, what your population is, and how all those pieces fit together. But generally, if you can, pick a theory, one that may be more process oriented, one that might be more cognitive behavioral or very structured, so one that's processy, one that's highly structured, that helps you cover a broader width of clients, so that you have lots of different ways of working, because clients have lots of different ways of learning. And so we need to not just do our theory of choice what we find interesting, we need to also work in ways, be able to connect with clients in ways that really resonates for them. Okay. So John is asking, what do you think of self-analysis from Freud to Karen Horney and Robert Lang? Better than meditation? I don't know. Well, meditation certainly has more research. I'll say that for it. And, everyone's different. Some people do self-analysis or use some of the analysis, psychoanalysis. And for some people, it really works and is very helpful. And I've seen people go into analysis for years and just be nuttier than ever. So it really the issue with any psychodynamic approach is whether or not it is efficacious and really works and really helps someone is totally dependent on the quality of the therapist rendering the services. So it's so clinician dependent that the approach, because it doesn't have a lot of external validation points. There's a lot. It is very much based on what the analysis the clinician is seeing in the client and how that works. So the quality of that approach is just dependent on the provider. Every approach, and there's tons of research. Actually, all therapies are like that. I think psychodynamic therapy is more so like that. Some of the best clinicians I've ever met have been psychodynamically focused, and some of the worst I've ever met have been psychodynamic psychoanalysis, where I don't know if I would say that about every other approach or other theories. There's something about that theory where it's the person. But the truth is they do research, and good clinicians are good out the door. Like in their first year, they're measurably different than other therapists. So much has to do with the self of the therapist, which is why in my approach, I really focus on getting real with the self of the therapist type of issues. Wow. Okay. We got lots of comments coming in. Let me see if I can figure out, let's see, questions coming in. So let me figure out where we're at, because it's scrolling on my end here. Okay. John, Dana. Will this course be, Dana is asking, will this course be repeated after the upcoming 12-week run? Yes, I'm not sure. Next time I do a live version of this may not be until next spring. I'm not quite sure, spring 2022, because I have a couple other courses that I'll be putting out related to license prep. So if anyone's listening, I do have a couple license prep courses, one for MFT and one for counseling, that are scheduled for 2021. So, but this course right now this is my live version. The only time I know I'm doing it for sure is this spring, starting now. Chandra is asking, she says, a little off topic, but what's your favorite way to work with couples with infidelity? Infidelity is an interesting one. And I remember, this is many years ago, okay, probably 15 years ago, before everyone was texting. Believe it or not, there was a time where not everyone texted all the time. And I had taken in 2 new couples cases, and one was there had been an affair that lasted over a year with a woman, and the man had an affair with this woman a few years prior, for probably over 2 to 3 years of having an affair with this extramarital affair, same person, spanning whatever, 2.5 out of 4 years, something like that. Same time I started with another couple, and it was the first text therapy, an emotional affair, a text therapy affair that had happened. And the outcome was really surprising. You wonder which couple survived. It was the couple with the many years of infidelity. The one with the text message affair did not stay together. So it's very, very fascinating. It's hard to know. But in terms of working with infidelity, I work with couples using EFT. It's only EFT and ICBT, and integrative behavioral couples therapy and emotionally focused therapy are the only 2 evidence-based couples treatments out there. So an EFT, working with attachment injuries around affairs, gets you really quickly to the heart of the matter. And I can tell you, using that, I can pretty much tell in the first couple of sessions whether they're going to make it or not, whether they're going to stay together or not, and where people are at. So I think EFT is really a very quick way to deal with infidelity. Okay. Safraz, wouldn't a range of the torts provide a better view of issues and solutions and give more flexibility? A range of the torts. I'm not quite sure what you mean by range of torts, so I'm sorry. Maybe you can explain that question a little bit better. Mimi is asking, currently I'm studying reflective therapy and working on finding a question to write an essay. Would you be able to help me find the important question? Who's the you in the question, but I'm struggling? I'm not quite sure how to help you there, Mimi. And then so Chandra is saying she is feeling, that she is in practicum and feeling very overwhelmed. I think, I think many people feel very, very overwhelmed in practicum and I think there are a couple of reasons why people feel overwhelmed. I mean, one reason is it's almost existential. Like sometimes I've talked to students and sometimes it's just realizing there's that much suffering going on in their community at that depth and that level. For some folks, that's part of it. Sometimes if you put a lot of pressure on yourself to be perfect, that can create a lot of stress. Many of the organizations, agencies you're working in can create a fairly stressful environment. But I think in large, a lot of why people are stressed out in practicum and starting out in that first year of doing therapy is that I promise you, I could give you such a clear and easy way to understand how to do therapy in that first year using all the research and theories and evidence we know. But our system is just not set up for that right now with this very let's go learn 12 different theories in your first, lecture course on theories, and you just end confused. And yes, we teach you to reflect feelings in your communication courses and those basic humanistic counseling skills. But you quickly realize when you're dealing with, multi-problem clients, like that is not enough, right? And we have not created simple ways to learn to do therapy. And we do a lot of just pushing people in the deep end has always kind of been the approach. And a lot of what I'm trying to do with Therapy That Works Live is to move away from that model and to actually give seasoned clinicians, who still have to integrate and use all this research that they didn't get in their graduate training, to give all clinicians a much clearer, simpler kind of way to learn to do therapy so it's not so overwhelming. The truth is it doesn't need to be this overwhelming, and it's unfortunate that is how our program or how our professions have evolved over time. Okay. So Sir Frost is asking what's your view regarding including physical activities and mindfulness with therapeutic discussions? Absolutely. I mean, once you learn how to connect with the client and you learn how to do case conceptualization, for most, and this is where you have to know what the research base says. It depends on what you're treating, but doing, mindfulness or physical activities can certainly work for certain clients, and especially if you, the therapist, are trained and passionate and you know how to use it, you can be very effective using it. So we have, I think, a lot of options when we're intervening, depending on who our clients are. But you have to know when you can do that and when the evidence base is very, very clear. Like with something with OCD, there's one type of intervention that works. So you don't get to be creative with OCD as much as you would like to be. Depression, generalized anxiety, you're free to be a lot more creative because there's more approaches that work. You have more options to use. But understanding this is really important. And I think this is what it should be. Every clinician knows this stuff, but there has not been an easy way to actually get access to that information. So that's a big part of my course. The treatment planning part of my course kind of relates to that. Okay. Okay. Let's see. Oh, I don't know. Okay, so Mimi's saying, I know, but thanks for reading my question and giving me an honest answer. Okay, Mimi. Yes, and boy, reflective therapy, I'd have to even know who you're citing for that one. Okay, Juan is asking a question. You work with children regarding children assessing for suicide and using the word around them when they are 5 to 9. Is it appropriate to use that word? I was always thought it to be as truthful. Truthful as possible. Any thoughts or recommendations? Wow, 5 to 9 in suicide. Well, this is where in my course I talk a lot about entering the client's reality, and the correct answer to that question depends on what the client's knowledge of all of that is. Generally, you know, there, if a child does not have the concept of killing themselves, a therapist discussing that with them is not going to be helpful if that child does not have that construction already. We as clinicians need to be very careful because our truth may not fit with their truth. And there isn't like an objective truth out there. There's very little of it. Let's say that. Very little, what one philosopher calls interobjective truth. Like we all kind of agree men don't give birth. Interobjective truth. There's very little of that out there. Like objectively, sort of, we all can see or agree to that. Most of the quote unquote truths we talk about, our labels we give it, come from a much more subjective reality. So, but introducing a new concept like suicide, because when we as clinicians make distinctions, we shift our clients' realities. So if a child 5 to 9 doesn't have any concept of a person intentionally killing themselves because they hate themselves, us making that distinction is not useful. And that's where using their language, their construction, what's meaningful to them would be more appropriate. And then, with children, there's a lot we don't tell kids, and because they're not developmentally ready for it. They don't have they don't even have the brain structures that would allow them to process that sort of information. And so just remember, until they're really, 25 is when the brain's done growing, but even teenagers at 13 and 14, you still have to deliver the truth in a way that's developmentally appropriate, that they have the mental and emotional maturity to process that information. So I hope that kind of helps related to that. Okay, so Grumpy is saying, I'm curious if you might be sharing with us how to engage clients for feedback. And so, you'll actually, because I'll be doing some live demonstrations with clients. You'll see me do a little mini qualitative interview with the client at the end of the session about how it works. And then you'll get to actually ask the client about how it worked for them too. So you get to actually be part of and observe how to use basic qualitative questions, in that way to get that type of feedback. I will introduce folks to the OSR, the outcome rating scale, session rating scales, which are very popular in Europe for doing it. They're simple, they're free. And so I think those are a great place to get started with learning how to get feedback from clients. But I think, it really depends on your work context too, how to do that. So that's the type of feedback. But I think that what you learn in Module 2 in this course, I'm going to teach you how to connect and talk to people in a way that is so real and authentic. I do often, especially when I have a difficult, I've had an intense session with clients. I ask them, I do a little mini qualitative interview with them because the qualitative piece really helps repair any damage that may have been done, keep that therapeutic relationship strong, and keep the communication open. It teaches the clients how to have those skills, which we need in all of our relationships. I'm always stunned how many grown, successful adults come in and they don't know how to talk to their partners about the simplest things. So I use that mini qualitative interview because it repairs the relationship in case any damage was done. It gives you a lot more credibility, and it allows them to be honest, because whether you're using pen and paper, standardized measures, it doesn't matter if the clients doesn't feel safe enough to tell you the truth. So I really try to teach a way of connecting with people and using more of the qualitative interview, because that is what would repair the relationship anyway. So let's fix it before we know it's broken. Let's see. Sir Frost is asking, is there an academic prerequirement? No, it's not. The course is designed for anyone who has started a master's mental health program. We do have folks from around the world, so I know there are different types of, any professional program in mental health who has started is great. We have some folks who are seasoned clinicians, 20 years experience. We have some folks who have not started field work yet, have not seen a single client yet. And the course is really geared to work for all of them, because I am just going to explain to you how to do therapy in a very, very simple, clear, elegant way. I'm going to use all the theories. I read all the theories. I've boiled them down. I created my secret sauce, and I'm just going to teach you how to do it. Very, very, very practical, hands-on, which I think we don't do enough of in this field. So I've certainly been part of one of the ones to give you tons of theory books to read, God knows. So I've done my theory part, and this is my very practical contribution to the field. So yes, the time of the sessions is going to be 10 o'clock Pacific. It was 10 o'clock on Sunday mornings, Pacific Standard Time. There will be some later times because I know I have had people around the world sign up for the class, so I'm trying to accommodate that. I'm working on that right now. So I'm thinking if I can get something 8 hours, 8 hours, opposite of that for some of those weeks, that will hopefully, for those of you who might have to get up in the middle of the night for this course, hopefully make it a little bit less painful if we can do it that way. Everything is recorded. So you will get recordings of all the live sessions. So if you can't make one, which I'm guessing everyone's not going to, there'll be a day or two where you can't make it. You can always go back and catch the replay, and you will have access to all of the materials, both recordings of the live sessions as well as all the lectures and handouts for a full year on the website. Okay, let's see here. Okay. Is there a link to the course? Well, let's make sure we put that in, huh? Mom to much. Sounds like a busy woman right there. Let's see. The site is Therapy That Works. Therapy That Works Institute. I'm trying to put it in here. Boy, it's therapythatworksinstitute.com. Carrie is my assistant. If she can make sure I type that in correctly, that would be totally awesome. Totally awesome. Okay, folks, we've got a few more minutes here. So if you've got any questions, please drop it in the chat so I can make sure I answer your questions. See another one coming in here. I've been an intern associate for 850 years now. Love it. I know it feels like that. Oh, sitting, yay, congratulations. She's sitting for her licensing exams at the end of February. I would love to take this course with you, but I'm concerned about the study time, maybe slim. Actually, Dana, you at the end of February? Oh, yeah, you're going to be fine. It's only a couple of weeks in. There might be a week where you want to cram or whatever, but I actually think you're going to love the energy of the actual group and the interactive part. We're setting goals. So your goal can be to study so many hours per week. The module, so the study time's not much because it's maybe an hour of watching the videos, which I don't know. I can easily watch an hour of videos in just 2 days of cooking meals and doing dishes. Actually, in 1 day. What am I talking about? So that's normally when I listen to all my online courses that I'm a part of. I just pop in my earbuds and buzz around the kitchen and have my little video above the sink when I'm doing those dishes. Works for me. You'll probably, so you're more than welcome. But I actually think if you're taking the exam at the end of February, because this course goes through April, so you will certainly benefit. And the first part's just about your own personal goals, which could be making sure you get an X number of study hours per week. And we'll look at how to, talk about how to do some of that. And I'll certainly support you personally and figuring out how to get those the study time in for your clinicals. Is there any studying to do between sessions? Any recognition of completion? So Sir Froz is asking that question. There's no studying. There's no papers. There's just videos to watch. There are handouts that you'll get and exercises you can get, and you're welcome to use them now. You're welcome to use them at the end of the program. For example, in Module 1, we kind of really go into self as a therapist, and creating. It's literally, I recommend this lifelong program that I have been using. I give you all the handouts to do it. I give you my exact goal sheet that I have been using for over 20 years for my own personal growth. And God knows you may not want to use that, till next New Year's. I don't know. Or at your birthday is another good time to do it. Or you might want to get started. Some people I can tell are going to jump in and start working on that immediately. So you get all these resources, so you don't have to certainly use them. So I think watching an hour worth of video is the basics. It's all you need to do. per week. And then there is the weekend sessions. And so those are 2 to 3 hours long. You can just choose to do the replay, or you can choose to come live and engage. Some people learn just as well. They actually learn better observing others, practicing. You'll have a lot of demos. I have a bunch of free bonuses that are going to come on. I got other people who volunteer to do demos with me. So you'll get bonus stuff, and you can watch it, when it happens to be live or when it is actually posted. So lots of ways to get through this course. Hi, Jay. Okay. Project post-grad. I'm going to read, let's see. I think I got, any recognition of completion. Yes, you're going to get a certificate in what I call therapy that works. So you will get both a CEU certificate and being certified in this approach, much the way you might be certified in like EFT. I do plan in 2022. If not, I may have to do this. Given the incredible energy in the group, I will probably do this sooner than later, but there'll be like a level 2 version where you get to keep practicing these, and we'll have more just consultation groups, a level 2 version of therapy that works. Really working to create a supportive community for therapists, counselors, psychologists, social workers to really get good at this and not be overwhelmed by doing this important work. So real excited about that. Okay. Carrie, if you can maybe just keep dropping that link in, I think, here we go. Okay. Let's see here. Okay. Project postgrad. Okay. I'm currently in my internship, and I feel like I have all this head knowledge from the past 2 years, of course, but I'm sort of lost in how to apply it at an agency. So I'm so grateful for this. Yeah, that's the problem. It really is a mess. Would you go to a surgeon who's like, yeah, I read all the textbooks and I got an A, on all of my licensing exams on how to do surgery? No, you wouldn't. You want to go to a surgeon who's done a lot of surgeries. And I really think we have to shift how we train in this field. This is a skill that we do, and we have primarily expected people to master this skill by reading books and listening to other people talk about the skill. We hardly even do demonstrations, and God knows there's not that much live training that goes on. It's really a mess. And I do think this new technology that you will get to experience, I think for the first time ever in a CEU course that I'm aware of, this simulated reality with simulated clients it's how we're going to train in the future. It's going to change everything. And so I'm really thrilled to be able to share this with you all. Okay. Edgar, you are so welcome. Matt White, do you incorporate Ericksonian hypnosis into this training? Not directly. No, I will talk a little bit actually though about solution focused and how some of that really did come, was influenced by Erickson. Most people don't realize that there is a hypnotic part of doing solution focused therapy well. Okay, awesome. Got about 3 more minutes here, folks. If there are any other questions about this course, I am just so excited to be launching it, to be getting started with it. I think it's just going to really, we've opened the course and folks are in. The energy is amazing. And so it's such a supportive, wonderful community. But I'm just so happy to hopefully be able to offer everyone a way to learn how to actually do this work well that doesn't totally overwhelm you. And I think it's so needed. I think this is the direction, the future of the field. And I'm so thrilled to be able to basically have the technology right now to be able to do so. Okay. Let's see. Whoa, will you? Okay, Juan is asking, will we be covering the third wave CBT or not much? So I actually will be covering how to do third wave CBT because I actually think, I'm not going to talk a lot about any theory. I'm just going to teach you how to do it. I have taken, but there is a lot of third wave CBT in this, but I'm not teaching theory. I'm teaching you a framework to utilize all of the practices that come from multiple different theories. And so, yes, third wave CBT is how they connect with clients is very similar to how newer psychoanalytics do it, how postmodern therapists do it. But I'm going to not use any of the language therapeutic. I'm just going to tell you what to do using very simple, clear metaphors and descriptions so that you can actually do it at the end of a 2-hour session. So I'm just going to make this really, really easy for you is my goal. Absolutely. Oh, hi, Danish. Dana is saying your mind is so wise and your voice is so soothing. Your spirit is so kind. Thank you. Oh, how kind. Thank you. Thank you. I'm so glad. You know, I think I'm just so passionate about making life and making this profession and this knowledge base easily accessible to the average clinician. You know, as an academic, as an author, I've kind of had the privilege and a good excuse, and I have been forced to really engage in all the theories, all the research, but I don't see 30 clients a week like some of you do. And so it seems like it's responsible for me to try to make all of this accessible because it really is easier than we make it. So I'm just so thrilled to be able to do that. Thank you. Tracy is asking, is there any chance you might be able to offer the course from now, same level? You know, right now I'm actually looking at launching it's going to be called Laughing Your Way to Licensure. You're the first group I've told live. But yes, 2 licensure courses. So I don't know if I'm going to be able to do this live course because it does take a lot of time and energy until next spring. So if you really want to take it this year, now would probably be a good time for that. Hey, Evelyn. Hi, Edgar. Thank you, thank you, thank you, everyone. Thank you. Thank you, folks. Well, it is 12 o'clock here. So yeah, and you can actually, I'll put this info at, I'll put the, if you want to ask me more questions, info at therapy that works. It's a long email, but I'll put that, you can actually, you can reach me here at that info at therapy.worksinstitute.com. If you're interested in the course, again, you will find that at therapy.worksinstitute.com. And if you're able to, really would enjoy having you. It is going to be such an exciting, it's such an exciting course already. The energy is just phenomenal. And it's my sincerest hope that this course really transforms you, not just as a professional, but as a human being. And I really feel like that's already happening. So if you're interested, please join us, and look forward to talking with you soon. Okay. Thank you, thank you, thank you. Thank you. Take care. Bye-bye, everyone.